WFYI podcast brought to you by Bloomington, Indiana, an American college town offering food and drink, college sports, outdoor activities, live music, cool art, and good times daily. Everyone is welcome in Bloomington. More information at visitbloomington.com.
This is WFYI News Now. It's April 12th, and I'm Abriana Herron. On today's show, a turnover of the Indianapolis Housing Agency is underway after years of dysfunction. And some families are still struggling to fill out the new version of FAFSA, the federal form for financial aid.
Our parents and our students are very concerned.
Those stories coming up. But first, the new installment of a regular segment called The Checkup from SideEffects Public Media, where the health reporting team explores a single question sparked by a recent news story, or maybe by one of our listeners. This time, the team looks into the health impacts of cannabis use.
The number of people who use marijuana nearly doubled over the past 20 years. But what do we know about marijuana safety? That's our checkup question for today. I'm Lizzie McGreevy, Community Engagement Specialist at SideEffects Public Media, and here with me is Managing Editor Farah Yusri.
Hi, Lizzie.
Hi, Farah. Quick question for you. How many people use marijuana in the U.S.?
So federal surveys in 2019 showed that around 48 million people ages 12 and older said they used marijuana at least once.
Okay, so I know there have been some studies on the health impacts of cannabis, but there is still uncertainty and a lot of misinformation floating around. Can you catch us up on what the latest research shows?
Okay, but let me give you an example first and hear me out. There is an uptick in the rate of people eating ice cream and the number of drownings during the summer. So clearly these two things are certainly associated, but by no means does one cause the other.
I love ice cream, but I'm not sure I follow.
Okay, so that's been the case with some of the research about cannabis. Some studies have shown benefits and, positive health impacts for using some products of cannabis. Other studies have shown an association between cannabis and psychosis or heart issues, for example. But many of those studies were, pretty small. And some critics of these studies said, hey, many people who use cannabis also use tobacco, so those results can be biased. Now, Lizzie, just a few weeks ago, a huge study came out, and it's funded by the National Institutes of Health, and it looked at nearly 500,000 people, and the conclusion was clear.
We found that cannabis use was associated with heart attack and stroke.
That's Dr. Solomeh Kihani, one of the study authors and a professor of medicine at the University of California, San Francisco. Her paper showed that compared to people who never used cannabis, those who smoked it daily had a 25% higher chance of heart attack and more than 40% higher chance of stroke. And those who smoked once a week had between 3 to 5% higher chances of these heart issues.
Okay, but wait, how do they address the whole thing with tobacco and cannabis use?
Well, good question. I'll let Dr. Kihani talk about that.
We created a very large data set, and we were able to exclude people that had used tobacco during their lifetime. And among these individuals that had never used tobacco, we found that cannabis use was still associated with increase of myocardial infarction and stroke.
She tells me they found that the heart attack and stroke risks associated with cannabis are very comparable to the risks of tobacco use.
But Farah, the way we look at cannabis is totally different than the way we look at tobacco.
Totally. I mean, every time I, doom scroll on Instagram or TikTok right after I put my kids to bed, I find this stunning influencer, showing me what she eats in a day and saying that, she uses some cannabis product. It's $1 billion industry. And what's really alarming, Dr. Kihani tells me, is that, at one point, tobacco was marketed to people as a helpful product for years and years. So there are some parallels between the early tobacco days and what we see with some cannabis marketing now.
Interesting. Yeah, I've seen Mad Men, so I believe that. So I know a lot of people are using cannabis in edible form now. Does it matter how it's used?
The researchers did not have enough people who only consumed cannabis through an edible form. So this study can't really answer this question. It is important to note, though, that there is emerging evidence that the psychoactive ingredient in cannabis, edible or otherwise, can cause some risks too.
So do you think this large study would impact any of the cannabis legalization efforts, for example, or maybe how medical providers talk to patients about it?
Well, legalization is a different story. It's about not using a punitive approach. So I don't know if that would or should change. But Dr. Kihani, says, given the growing evidence, she hopes medical providers would ask their patients about their cannabis consumption, just like, they do with alcohol and tobacco.
I feel like we need a lot more studies about cannabis, especially considering legalization and possible health factors. Thank you for this enlightening, as always, checkup, Farah.
Thank you, Lizzie.
And that was The Checkup, a segment of Side Effects Public Media. Side Effects is a regional health reporting collaboration of NPR member stations across the Midwest, based here at WFYI. If you have a question for The Checkup, we'd love to hear it. Whether it's about the complex U.S. healthcare system, something you're usually too embarrassed to ask, or you just want to hear from an expert about a health policy topic, you can send an email to news@wfyi.org. And a takeover of the Indianapolis housing agency is underway. WFYI's Jill Sheridan reports the move comes after years of dysfunction at the agency responsible for providing affordable housing in the city.
The City of Indianapolis and the U.S. Department of Housing and Urban Development have entered into an agreement that seeks to reform IHA and improve housing options for low-income residents. HUD Principal Deputy Assistant Secretary Richard Menacchio says an initial investigation uncovered numerous financial and operational issues at IHA and its properties.
Conditions were poor, very difficult to track the funds. The voucher program wasn't working right. Not much was working right.
The local board has been removed and HUD has appointed a representative to serve. The city will also seek a local recovery monitor to lead changes that include building maintenance, landlord relationships, and waitlist management. IHA manages 20,000 low-income households in Indianapolis. I'm Jill Sheridan.
And for our final story today, Indiana high school seniors are struggling to complete the new version of the FAFSA, or Free Application for Federal Student Aid. That's because the rollout of the Revamped form has been plagued with technical glitches. As WFYI's Lee Gaines reports, some fear that the financial aid fiasco will prevent students from attending college at all.
It's lunch hour at Ben Davis High School in Indianapolis, and high school senior Isela is calling the Federal Student Aid Hotline.
We're back on hold. Okay.
What does that mean, that you're back on hold?
That I didn't get hung up on automatically, and that a representative will talk to me, hopefully soon, because I need to go to class.
We're not using her full name because her parents are undocumented. Every time Isela has tried to fill out the FAFSA online, she gets an error message because her parents don't have social security numbers. She finally gets someone from the Federal Student Aid Office on the line. Here, she's explaining the problem.
But the issue was I'm stuck in the loophole where my mom can't make her FSA ID because she doesn't have a social security number.
This wasn't an issue under the old FAFSA. Kids who are citizens who had parents that weren't could complete the application. The new FAFSA was supposed to make it easier, but the rollout has been riddled with delays and malfunctions. Students whose parents are immigrants have had an especially hard time completing the application. And now, Indiana law also requires high school seniors to complete the FAFSA.
I need this to graduate and for my college, in which I plan on doing next year. And if I don't fill this out, what's my plan?
Filing the FAFSA is an essential step for students to get college financial aid. It's used to determine not only federal grant and loan eligibility, but also how much money students can get from colleges and from the state. Knowing how much money they'll receive can be the difference between going to college or not for many students.
Our parents and our students are very concerned.
Maria Quiroz Southwood is with the Indiana Latino Institute. She helps Latino students who are in college as well as those who want to go to college. And she spent a lot of time over the last few months trying to help families fill out the FAFSA.
They're very, very concerned, almost to the point of tears, because they're like, if this doesn't go through, I can't pay for my child's college education.
College-going rates among Indiana's Hispanic and Latino high school graduates lag behind those of their peers. And while the number of high school seniors submitting FAFSA has declined across the country, it's steepest at schools with larger numbers of low-income families and students of color.
My biggest concern is that there are going to be students that fall in the cracks.
Meaning the flawed FAFSA rollout may lead some students and families to give up and decide that college isn't for them, at least this year. The Federal Student Aid Office is aware of these problems. They've released some fixes and statements saying they're working on correcting the remaining issues.
Okay, can I merge into a call?
Back at Ben Davis High School, Isela patches her mom into the call with someone at the Federal Financial Aid Office. But her mom speaks mostly Spanish, and the person they're on the phone with doesn't.
Okay, ma'am. It looks like I would have to transfer you over to the Spanish queue, ma'am, where they can help you create your account, ma'am.
Te van a transferir a la otra línea.
Isela expected applying to college to be a challenge because her parents didn't attend.
Like, I always knew that I was going to experience some struggles knowing how to fill out FAFSA and everything, but not as bad as this is.
Isela and her mom were eventually able to get a hold of someone who came up with a workaround that allowed her mom to complete her portion of the application. Getting this far is a huge relief. Isela plans to go to Ball State University this fall. I'm Lee Gaines.
That's all for today's episode of WFYI News Now. Our podcast is produced by the following people who live in your community: Drew Daudelin, Kendall Antron, who composed the music for this podcast, and me, Abriana Herron. Our news director is Sarah Neal-Estes. If you like today's episode, remember to subscribe and share. And follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.